Assalamu alaikum, dear students. I hope everyone is fine and is enjoying a good health. I'm Asma Kamran and we are continuing our chapter Digestion. Today we will learn about the accessory organs, that is structure and function of liver, gallbladder, structure and function of pancreas, secretion of pancreatic juice, and disorders of digestive system. And in the end we will look at exercise. Now, the role of accessory glands. Accessory glands are not the part of digestive system, but they are associated with digestive system and help in the digestion of food. The accessory glands or organs of the digestive system are liver, gallbladder, and pancreas. As you can see in this figure, this is liver, which is one of the largest and important organ of the body. Just towards the lower side of the liver, this globular structure is present, that is gallbladder, and in the curve or in the fold of the duodenum, this leaf-like structure is pancreas. Now the liver. Liver is one of the largest and important internal organ of the body. Structurally, liver consists of two lobes, right lobe and left lobe, and two minor lobes. Towards the lower or towards the inferior side of the liver, there is a porta. Porta means gate, that is for the exit and entry of blood vessels, ducts, and nerve. Liver consists of two lobes, and from these two lobes, two ducts arises. Right hepatic duct from the right lobe and left hepatic duct from the left lobe, and both hepatic ducts combine to form common bile duct. This common bile duct then combines with a duct which arises from gallbladder, which is called cystic duct. So cystic duct and common hepatic duct combine with each other and form common bile duct. This common bile duct then opens into duodenum at a site which is called major duodenal papilla, along with the pancreatic duct which arises from pancreas. As you can see in this figure, this one is right lobe of the liver and this is left lobe of the liver, and from the left lobe left hepatic duct arises, from the right lobe right hepatic duct arises. Both combine to form common hepatic duct, and cystic duct arises from gallbladder. So cystic duct and common hepatic duct combines to form common bile duct, which opens into duodenum at this major duodenal papilla, along with the pancreatic duct which arises from pancreas. This major duodenal papilla, or the opening of common bile duct and pancreatic duct, it is guarded by a ring of muscle that makes sphincter, which is called hepatopancreatic sphincter. Now the composition of bile. Bile is a secretion which is secreted by liver, and then it is stored and concentrated in the gallbladder. Bile consists of water, salts that are called bile salts, that is sodium glycocholate and sodium taurocholate, bile pigments, that is bilirubin and biliverdin. These are the broken pieces of hemoglobin or red blood cells. Cholesterol, lecithin, which is the phospholipid, mucus, which is for the lubrication of walls of the intestine, and cell debris. As you can see that there are no enzymes in the bile. So the function of the bile is emulsification of fats, and this emulsification is done with the help of bile salts. And bile pigments, they are only required to be adjusted out of the body. Now the role of bile. Bile salts, as I told you, help in the absorption of fatty acids, and this absorption is by emulsification of fats, so that lipase, which is fat digesting enzyme, convert fat into fatty acids and glycerol. And now we know that what is emulsification. Emulsification is breakdown of large fat droplets into smaller droplets to increase the surface area for the action of lipase, so that lipase converts fat into fatty acids and glycerol. Bilirubin and biliverdin, they are formed by the breakdown of hemoglobin. The bacteria which are present in the intestine, they convert bilirubin into pigments that give characteristic brown color to feces. Some of the pigments are absorbed from the intestine and then they are transferred to the kidney, where they are modified and excreted in the urine and give characteristic yellow color to urine. Now the secretion of bile. Acidic chyme which comes from stomach into the duodenum. Fatty acids present in the acidic chyme, they stimulate the walls of the duodenum to secrete a hormone that is called cholecystokinin into the blood. Similarly, the acidic chyme, it stimulates the wall of the duodenum to release another hormone that is called secretin. Both secretin and cholecystokinin are secreted in the blood. Through blood circulation, cholecystokinin reaches to the gallbladder, where it causes the contraction of the gallbladder, so that the bile which is present in the gallbladder, it is released through this common bile duct into the duodenum with the help of hepatopancreatic sphincter, which is relaxed by the action of cholecystokinin. So the other function of cholecystokinin is the relaxation of hepatopancreatic sphincter, which is also called sphincter of Oddi. And secretin, through blood circulation, it reaches the liver cells, where it stimulates the liver cells to release bicarbonate into the bile. The function of the bicarbonate is the neutralization of acidic chyme. This is another figure that shows the release of bile. You can see that food, when it comes from stomach into the duodenum, the walls of the duodenum secrete cholecystokinin. In this figure, only cholecystokinin is given. Cholecystokinin enters in the blood and stimulates gallbladder. It causes the contraction of the gallbladder so that the bile is released into the duodenum through this common bile duct, and its cholecystokinin also relaxes the sphincter that is called hepatopancreatic sphincter, so that bile from the common bile duct enters into the duodenum. Now the functions of liver. As I told you, liver is one of the largest and important organ of the body. Many functions are performed by the liver. Number one is storage. Liver store glycogen. The excess glucose which is present in the blood, it is converted into glycogen with the help of liver cells, which are called hepatocytes. Liver also store fats, vitamins, that is A, vitamin B12, vitamin D, vitamin E, and K. It also stores copper and iron. Another function of liver is metabolism, or it have a metabolic role. Liver is responsible for the glucose metabolism, that is glycogenolysis, means breakdown of glycogen. Whenever glucose is required in the body, glycogen, which is a stored molecule in the liver, it is broken down into glucose. So the breakdown of glycogen is called glycogenolysis. And gluconeogenesis means the formation of glucose molecules from amino acids or fatty acids and glycerol. Then liver is also responsible for the denaturation and phosphorylation of fatty acid. Denaturation means breakdown of fatty acids and also the addition of phosphate, that is phosphorylation of fatty acid. Similarly, liver is also responsible for the deamination of excess amino acids which are present in the blood. Deamination means removal of amino group from the amino acids. so that with the deamination of amino acids they are converted into pyruvic acid and ammonia. And due to this deamination of ammonia, it is converted into urea that by a cycle that is called ornithine arginine cycle. It is also called urea. Urea is a waste product which is then delivered to the kidney to be excreted out of the body. Another function of the liver is synthesis, that is synthesis of vitamin A from carotene. It also synthesizes proteins, albumin from amino acids, and blood proteins, that is prothrombin and fibrinogen. Prothrombin and fibrinogen, they help in blood clotting. Another protein, heparin. Heparin prevents the blood clotting. Another function of liver is catabolism. Catabolism is breakdown role of liver. In the liver, there is a phagocytosis of red blood cells so that bilirubin and biliverdin are produced, which are the breakdown product of hemoglobin. Bilirubin is an orange pigment and biliverdin is a green pigment. And one of the major role of liver is detoxification, that is the removal of harmful and toxic substances from the body. And another role of the liver, which is only in the fetal stage or when the fetus formation takes place, at that time liver is responsible for the formation of red blood cells. Now the gallbladder. Gallbladder is a sac-like structure which is present towards the lower or inferior side of the liver. It is about 8 centimeter long and 4 centimeter wide, and it is connected to the common bile duct by the cystic duct. And bile is stored in the liver. Bile is secreted by the liver and stored in the gallbladder. In this figure you can see this is gallbladder, and the duct which arises from the gallbladder is cystic duct, which combines with common hepatic duct, and then both combine to form this common bile duct which opens at this ampulla, and this opening is guarded by hepatopancreatic sphincter. So this ampulla is also called hepatopancreatic ampulla, and along with this pancreatic duct also opens at this ampulla or by this hepatopancreatic sphincter. Hepato means liver, pancreatic is for pancreas. And you see that pancreas is present in the curve of the duodenum. Now the third accessory gland is pancreas. Pancreas, it have a dual function, that is endocrine as well as exocrine. Structurally, pancreas consists of head, which is present in the curve of duodenum as you can see in this figure, and then it consists of body and tail, which is present towards the spleen. In this figure it is very much clear, that is head, then neck, body, and this terminal part or pointed part is tail. And the pancreatic duct arises from this pancreas and open into the duodenum. Again, this is the structure of pancreas. You can see that it is present just beneath the stomach in the curve of the duodenum and consists of two parts, that is endocrine part and exocrine part. Endocrine part secretes hormones and exocrine part secretes pancreatic juice. And in this figure you see this is the exocrine part, which is called acini, or singular is acinus, and along this are scattered patches which are called islet of Langerhans which are the endocrine parts of pancreas, and they secrete hormones, pancreatic hormones. This is another figure. Here you can clearly see this is exocrine part, consists of these acini, and along the acini these are the patches of islets of Langerhans. The cells of the acini, they secrete pancreatic juice, so these are the exocrine part, and islet of Langerhans secrete endocrine hormones, or hormones which are released directly into the blood. Now the pancreas as exocrine gland, because exocrine parts secrete pancreatic juice which then help in digestion. The pancreatic juice consists of mucus, again for the lubrication of walls of the intestine. It also consists of bicarbonate, which is for the neutralization of acidic chyme which comes from stomach, and it consists of number of enzymes. There are most of the enzymes for the digestion of proteins, that is trypsinogen, procarboxypeptidase, and chymotrypsinogen. All these hormones and enzymes are secreted in inactive form, and they are converted into their active form so that they can digest proteins. Enteropeptidase, which is also known as enterokinase, is an enzyme secreted by the wall of the intestine. This converts trypsinogen into trypsin. This trypsin then again causes the conversion of trypsinogen into trypsin, and trypsin then converts chymotrypsinogen into chymotrypsin, and it also converts procarboxypeptidase into carboxypeptidase. These are the enzymes which are secreted by pancreas and are the part of pancreatic juice. As you can see that along with proteolytic enzymes, that is protein digesting enzymes, it consists of amylase. Amylase is responsible for the digestion of starch. Proteolytic enzymes, that is trypsinogen, chymotrypsinogen, procarboxypeptidase, proelastase, as we already have seen that these are the inactive form of enzymes. They are converted by enteropeptidase or enterokinase, and then by the trypsin as well. Trypsinogen is converted into trypsin, chymotrypsinogen into chymotrypsin, procarboxypeptidase into carboxypeptidase, and proelastase into elastase. These all are protein digesting enzymes and are responsible for the digestion of proteins. Then fat digesting enzymes, that is lipase, cholesterol esterase, phospholipase. Their function is digestion of fat, cholesterol, esters, and phospholipids. Pancreatic juice also consists of deoxyribonuclease and ribonuclease. As the name shows, deoxyribonuclease digests DNA and ribonuclease digests RNA. So that is the composition of pancreatic juice. Now the secretion of pancreatic juice. Remember the secretin and cholecystokinin. When the acidic chyme from the stomach enters into the duodenum, the fats present in the acidic chyme, it stimulates the wall of the duodenum to secrete cholecystokinin, and the acidic chyme secretes the duodenal wall to secrete secretin. Both secretin and cholecystokinin, they are released in the blood, and through blood circulation they stimulate pancreas. Secretin, which is released from the duodenum, it stimulates the pancreas to release a watery secretion which is rich in bicarbonate. Bicarbonate neutralizes the acid present in the acidic chyme. Similarly, cholecystokinin, which is released from the duodenum through blood circulation, reaches the pancreas, and then it stimulates the cells of the pancreas to release enzymes. which are responsible for the digestion of different components of food.
When food reaches the stomach, it presses on its walls, thereby increasing the secretion of gastric juice and stimulating the secretion of the hormone gastrin. When gastrin passes into the blood, it stimulates the cells of gastric glands to continue their secretion of gastric juice. The acidic contents of the stomach pass into the duodenum, where they stimulate the cells to secrete intestinal juice and two hormones, secretin and cholecystokinin. These hormones then start to circulate in the blood. On reaching the pancreas, secretin and cholecystokinin stimulate the secretion of pancreatic juice, which is rich in sodium carbonate, NaHCO3. Cholecystokinin also slows down the mechanical activity of the stomach, and along with other hormones known as enterogastrones, inhibits the secretion of hydrochloric acid. Secretin increases the secretion of bile by the liver. The acidic chyme in the duodenum and cholecystokinin stimulate the contraction of the gallbladder as well as the secretion of bile.
Now the disorders of digestive system. Ulcer, its causative agent is Helicobacter pylori, which is a bacteria, and commonly it is called peptic ulcer. It is of two types, duodenal ulcer and gastric ulcer. Pathological factors are some medicines, that is aspirin, non-steroidal anti-inflammatory agents, and actually ulcer is that the stomach acids, they digest the mucosal lining of the stomach or of the duodenum, and 90% is duodenal ulcer and 70% is gastric ulcer. And medicines like aspirin and non-steroidal anti-inflammatory agents, they also aggravate ulcer. And sometimes peptic ulcer runs in families, that is, it is hereditary disease. Prevention is by avoiding smoking, aspirin, excess coffee, alcohol, and also missing a meal. Treatment is with the help of medicines for acid suppression, that is antacid, milk, intake of food, especially in case of duodenal ulcer. Vomiting also relieves pain in gastric ulcer. This is a figure that shows peptic ulcer, that is gastric ulcer, as well as this is duodenal ulcer, which is caused by some medicines, and Helicobacter pylori. As you can see in this figure, in ulcer, this is the digestion of the mucosal part of the wall of the stomach or of the duodenum due to high concentration of HCl. These are the foods that can prevent or heal ulcer, and the foods that should be avoided in case of ulcer. Now the food poisoning, it is acute gastroenteritis, which is caused by the ingestion of food or drink that is contaminated with bacteria or toxins present in the food. It is usually a diarrhea, vomiting, and abdominal pain. You can see the symptoms are abdominal cramps, nausea, diarrhea, fever, vomiting, dizziness, and it is caused by the toxins produced by the bacteria Salmonella and Campylobacter. It is prevented by washing hands and washing utensils, eating fresh food and vegetables. And rotten or spoiled food, stale food, rotten eggs, and contaminated food can cause food poisoning, which all these foods may contain toxins produced by Salmonella and Campylobacter. Its treatment is by taking soft, easily digested diet such as soup, fruits, tea, cold drinks. Usually in case of dehydration, ORS is given. Antidiarrheal agents such as loperamide and antibiotics are also given. Next is dyspepsia. Dyspepsia means incomplete or imperfect digestion. As you can see, this causes pain and discomfort in upper abdomen, heartburning, nausea, and gas. Dyspepsia, it is due to excessive acidity and faulty stomach or intestinal function, and may also be due to insufficient bile secretion. Its prevention is to stop smoking, weight reduction, small meals should be taken, alcohol should be avoided, tea, fatty foods should be avoided, heavy lifting and bending after meals, that is also should be avoided, and late night meals should also be avoided. Treatment is with the help of antibiotics and drugs to decrease acid production such as cimetidine, and stop NSAID, that is non-steroidal anti-inflammatory drugs like aspirin. Next is obesity. Now, obesity means abnormal amount of fat on the body, and it is due to high caloric food, stationary or sedentary lifestyle, due to weight gain in the midlife, maybe due to low secretion of hypothyroidism or thyroid secretion. It may be hereditary or maybe sometimes due to some drugs. Prevention of obesity is by controlling the intake of food or by caloric control, by doing exercise, by controlling your weight. More vegetables should be taken, more water should be taken, and there should be a healthy sleep. Due to obesity, there are many other disorders may appear in the body. That includes osteoarthritis, increase in the lipid content, heart disease, eating disorders, stroke, hypertension, sleep apnea. Sleep apnea means the stoppage of breathing during sleep for a minute or for seconds. Next is bulimia nervosa. Bulimia nervosa is a neurotic disorder, means it is related to nerves, and usually it is common in girls. It is an eating disorder in which one starts to consume large amounts of food at a time. Then it is followed by purging, maybe by the use of laxatives or over exercising to rid themselves of the food they ate. Purging means vomiting. Laxatives are the agents or medicines that induce egestion, and over exercise means excessive exercise to reduce the effects of food. As you can see this in this figure, they eat voraciously and then induce vomiting so that food then leaves the body. Bulimia nervosa, it is, as you can see in this figure, that at a time they eat a lot of food and then experience a feeling of guilt, shame or anxiety, and then they purge or they induce vomiting to remove the food from the body Sometimes they use pills, diet pills, or diuretics to control weight, and they do excessive exercise to prevent the weight gain. The treatment of the bulimia nervosa is not simple. It also requires psychotherapy, medicines, nutritional education, and sometimes hospitalization. Now the last one is anorexia nervosa. As you can see in this figure, it is a loss of appetite due to the fear of becoming obese, and this is common especially in females between the age of 12 and 21 years after the onset of puberty. It is due to the loss of appetite and due to the fear of becoming obese. As you can see over here, the anorexic girls overestimate the size of her own body, assumes herself overweight. In reality, she has dropped her weight to a dangerous level, and the loss of feminine characteristics which are produced at the time of puberty, it enables the girls to retreat in a childlike state in which she feels safe. These are the signs of anorexia. They cannot maintain their healthy weight and have an extreme fear of weight gain, continuously dieting and continuously exercising to reduce weight, and are very obsessed with diet, caloric intake, and have restriction on many different types of food, avoid food and denying hunger, develop rituals regarding the food, what they have to eat, what they do not have to eat. Treatment of anorexia nervosa is required, especially in case of these girls. These patients, they fed through any other route other than alimentary canal, that is usually intravenously, but the recovery is very slow. It may take 2 to 4 years and sometimes even longer than this. The therapy not only requires a doctor, it also requires a therapist and a dietitian. That is all about this chapter, digestion. I hope it is clear to everyone. Now comes to the exercise. Question 1. Select the correct answer. Number 1. Pepsinogen is activated to pepsin by active secretion, active secretin, hydrochloric acid, active pepsin, and HCl gastrin. It is C, that is active pepsin and HCl. Liver secretes bile into duodenum, ileum, jejunum, peritoneum. That is number 2. It is A, that liver secretes bile into the duodenum. Number 3. Emulsification of fat will not occur in the absence of lipase, bile pigments, bile salts, pancreatic juice. It is C, that is bile salts. If bile salts, there will be no emulsification. Number 4. Fatty acids and glycerols are first absorbed by lymph vessel, villi, blood capillaries, hepatic portal vein. Of course, that is B, villi. Then it reaches the lymph vessel and then to the different parts of body. Number 5. The hormone responsible for stimulating secretion of hydrochloric acid by stomach cell is pepsin, secretin, gastrin, insulin. That is C, gastrin, hormone secreted by the wall of stomach. Number 6. The diagram shows part of the human alimentary canal which two structures produce substances involved in the digestion of fat. A 1 and 5, B 3 and 4, C 2 and 3, D 4 and 5. It is B, that is 3 and 4, that is liver and gallbladder. Number 7, on removal of pancreas, the compound which remains undigested is protein, fat, glucose, lactose. It is A, that is protein. Remember, pancreatic juice consists of many types of proteolytic enzymes. So, these proteolytic enzymes are responsible for the final digestion or breakdown of proteins. Number 8, excess intake of the following causes obesity: A, vitamin, B, proteins, C, carbohydrates, D, minerals. That is C, carbohydrates. Number 9, enzyme trypsinogen is changed to trypsin by A, gastrin, B, enterokinase, C, secretin, D, hydrochloric acid. It is B, that is enterokinase, which is an enzyme secreted by the wall of the intestine. Now your assignment is short questions. Attempt question number 11, 12, 14, 15, 16, 17, 18, 19, 28 and 29, and the answers of these questions should not be more than 3 to 4 lines. They should be to the point and the answers should be precise. That is all about alimentary canal or digestion. Thank you very much.